I'm Robin Geyer. I'm the manager of long-term care at Kahnawa Memorial Hospital. I'm here today with Samantha Cross, the manager of short-term care at the hospital, and we were asked to come in to give an update on how everything's going with our residents and all the patients at the hospital. So one of the things that we're doing right now is throughout the pandemic, we have had access to natural caregivers who are family members who come in and assist with care for any of the residents who need. So in the last couple of weeks, mostly since December, we've allowed more natural caregivers in, and we're pretty much at the point where whoever is requesting to come in to see a family member is being permitted. It's just done on a schedule. That way we can trace who's on the floors at any time, and if contact tracing is needed, we're able to do that. The residents are doing very well. Everybody is COVID-free. We know how to respond when there are cases with staff, so we have a lot of practice in doing that, and we do well. The staff do well. The family members coming in do well with respecting all our infection control guidelines. Another thing that's changed is our activities, which were stopped at one point. All group activities were stopped. We were focusing more on an individual basis. So now our group activities have resumed. For example, today they're doing Valentine's Day bingo, so the residents are really enjoying getting back into those type of activities and spending time together. For the ones who don't want to do the group activities, there are still one-on-one activities happening. So now here's Samantha Cross, the manager of short-term care.
Good afternoon. I'm Samantha Cross, the manager of short-term care at Kahnawa Memorial Hospital. So as Robin said and explained, that we are also doing the same thing in short-term care with the natural caregivers. As we get admissions, we're assessing and trying to have a family member coming for each patient. Another thing that has changed are our drop-offs. So they were bi-weekly before, every second Sunday, but now we have changed them to, it's every day, so there's no set time. You can come and drop off any items for your loved ones at our inpatient department security. You could just leave it there with the security. Their names have to properly be on there, and we have staff that are regularly going downstairs to check on the items and deliver them to the patients or the residents. So of course we still ask that things are properly labeled and that there's no food being dropped off, as we have them going down several times a day to check on these items and bring them upstairs. Another thing that we would like to just say is we are hoping to move forward in the next coming time to look at opening up again, and also looking at opening up our beds. So we're hoping this is something, as things start to change, that we can slowly progress into opening up some of our beds in short-term care and having a little bit more movement. And we still haven't moved into our unit yet, which has been waiting for us. It has been reserved for a COVID unit. So we're hoping that we can open up soon and have more bed availability on that end. So that's just a few updates on our end for Kahnawa Hospital. Kahnawà.
Thank you very much for that information. I think people are, curious on what's happening. I guess behind the scenes, so to speak, at Kahnawa with the residents. So it's good to know. It's also a sign of the times as things progress and things evolve. That so do things over at the KMHC inpatient, both long and short term care. Along the same lines, I just want to start off by mentioning, certainly over the past few weeks, we've seen a drastic change in the situation with the Omicron in the community. If you look back about a month ago, I think just about everybody in the community either knew somebody who had COVID or somebody who was in isolation. So things have increased tremendously for the positive over the past little while, which allowed us to take the first steps in terms of reopening the community, lessening restrictions, and that was put into place, as we know, almost 2 weeks ago now, a week and a half ago, where restaurants, bars, social clubs, and gaming was opened back up at a 50% capacity. we did say we're going to move as quickly as we can, as safely as we can, to further reduce restrictions. And again, based on an assessment of where things are happening in the community, what's happening around us, and we have made some further recommendations, and it was a meeting with the task force yesterday, and I'm here to give you an update on that meeting and some of the, I guess, the positive developments that came out of that meeting. First of all, regarding restaurants, bars, and social clubs, even the cigar lounges, again, those have been some of the areas that have been hit hardest, throughout the pandemic, with opening and closing and such. They are currently operating at 50%, but effective Monday, the 14th, these areas will be permitted to operate at full capacity. Once again, very similar to the way it was pre the Omicron wave or the fifth wave. So that's some very positive news, so that they can get the economics of their business up and running as quickly as possible, get people back to work as quickly as possible. So as of Monday, that will be able to be at 100% capacity. Obviously, there's still some guidelines in place regarding masks where appropriate when people are moving around. There still is the requirement in many of these facilities for proof of vaccination, which is something that is currently being assessed on when that could sunset, but that, as we speak today, that will remain in effect. But again, like I said, it's being assessed as we speak. As well as the funeral, we're limited on funerals and ceremonial services in churches. Those restrictions have been lifted. They have the masking requirements when people are indoors is still something that is going to be required, but people will be able to carry on those activities for the most part with very little restrictions. Indoor private gatherings as well. We had a 12-person limit, but moving forward, what we're looking at is not having any restrictions on personal home visits or home gatherings. It's certainly recommended that we still keep them to a minimum, but we're not going to have any formal directives issued for personal gatherings. We just look to each individual to do their own level of assessment, their own level of risk in which they're prepared to tolerate within their homes, within their family, and make those decisions accordingly. I think everybody has enough education and knowledge to make those decisions appropriately, especially if you have people who are vulnerable within your household or within your gatherings, to take those extra precautions. So again, more positive developments there. Outdoor gatherings as well, though no restrictions on outdoor gatherings. Again, recommendations in terms of masking if you're in larger crowds, especially with people you don't really know or associate with often. Definitely masks are recommended. If you're immunocompromised or one of the vulnerable population, again, masks are certainly highly recommended for you in those settings. Sports have been given the green light to return. That's also in line with the leagues that are currently in the process of getting going again, hockey leagues and various other sporting events such as wrestling and so on. So we're going to not have any restrictions, from a task force perspective, but there may be some criteria that the leagues will impose upon various players or criteria to remain safe. So these are all going to be posted up on our site as we normally do, but these are some significant changes, again, because of the way things are progressing in our community. And also, certainly around us, things are much better. And we're glad that some of the predictions we've seen in December, that the Omicron wave came on very strong, came on very fast, and then plateaued relatively quickly, and then still had a steady decline. We've seen that around the world, and that was the what we were hoping to see here in Kahnawà, and fortunately, that's the path that we're on. So with that, also need to mention that the current state of emergency, which is set to expire on February 20th, will come to an end on that date. part of my role as a public safety commissioner is to make recommendations to chief and council on the a state of emergency. And at this point in time, there is no intention of requesting or recommending an extension. Again, all positive news, and we will move into a recovery phase. We want to see that recovery phase happen as quickly as possible, as safely as possible, as well as the shift of decision making moving forward and how that transition will take place over the next little while. So things are progressing in the right way. This is thanks to cooperation of the entire community, support across the board, and we are getting really close to hopefully having that state of our new normal relatively shortly. So with that, I'll leave it there, and I have Kahsennenhawe Sky Deer here, Grand Chief, to have a few words. Thank you very much.
Saigo what Kahnawà, Kahsennenhawe Sky Deer Yujats. So I think the words that Lloyd shared today is definitely something the community has been looking forward to hearing in terms of moving toward opening pretty much 100% capacity starting on Valentine's Day, and talking about the work ahead and what the state of recovery is going to look like. We had been there before the whole Omicron variant hit the community in December around the holidays. But this time around, we're looking at the collaboration, because obviously there's still a role for public health and public safety to play as we move forward into the state of recovery, as well as that of the Mohawk Council of KahnawakeTV. So as we as Lloyd mentioned, that once the state of emergency comes to an end and we move to, again, the state of recovery, other decisions are going to need to be considered. Obviously, we know it's been very contentious in the community with the implementation of the QR codes or passports, and I think that's something we're still looking at in terms of where that's going to go in the future. Right now, obviously, we're not recommending that that is not still implemented. It is going to be for the time being. As we said, we are still in a state of emergency. There is still COVID. We can't 100% let our guard down, but I think what we're moving toward is the fact that now we all have the tools. We've learned over 2 years of how to live in the midst of the COVID reality, and that we're just going to have to meander through it in the best way possible. There is always still going to be that risk. It's not like it's gone, so to speak. I mean, if you read in the news, there's even a sub-variant of Omicron that is being, I guess, followed in Europe and different countries around the world. So obviously, we're going to be keeping our eyes on this. But hopefully, right now, as the community moves in this direction, I think it's something that we've all been looking forward toward. It was a very challenging, holiday. I know a lot of people were looking forward to having that time to, gather with family and just enjoy, spending those days together. And obviously, it was, really challenging. And again, I just have to commend the community for everybody's response in terms of, measures that, sometimes we might not like it, and understanding that for us as KahnawakeTV and Ongwehoe people, some of our values and principles of always looking out for the collective, and that trumps our individual, rights sometimes, and it's a hard balance. And I understand that, but at the end of the day, I think we did amazing as a community, and I just again have to commend everybody. So what we're going to be looking at in the state of recovery, there's certain guiding principles I think we need to adhere to, and obviously there are still people that are passing away from COVID. I think it was mentioned in Quebec today, 35 new cases, but it's always been to save lives and minimize hospitalization and death. And in the community, obviously, there have been some hospitalizations, but we haven't seen the same kind of impacts that other communities have when it came to the number of people passing away from the virus. Of course, always protecting our most vulnerable or the immunocompromised, immunosuppressed, our elders, children. So that has always been at the forefront of our minds in the way we've tried to handle, the pandemic response and trying to protect them. And now we're looking at, of course, minimizing the impacts to people's overall mental health. I know it's been 2 years. It's been challenging, to say the least. The way things have been changing, directives, measures, even the changes in information as it pertains to, when you have to isolate. And there's definitely what we call COVID fatigue, right? I know people are just at this point over it. So we're looking at obviously balancing people's mental health, protection of healthcare workers. We just heard from 2 nurses here in the community, and the awesome work that they've been doing. It's nice to hear now that our elders that are in the long-term care are, starting to, re-embark in having activities together, and that's also good for their overall well-being. Of course, balancing political needs and economic impacts, and the closures and the different ways that we've had to do things over this time obviously has always been with these principles and objectives in mind about protecting everybody and ensuring that, as a community, we got out of this with the least amount of loss as possible. Again, providing opportunities for physical activity. We're in the midst of Winter Carnival. I would encourage people to participate and get out there. It's nice to be outdoors. Not really sure of the calendar at this point and what's coming up. I think there was broomball last night and volleyball on Monday. So, again, it's still keeping in mind there's still some risk, but at the same time, we want to try to enjoy life. And I think that's the direction we're moving now, is everybody just has to have their own calculated risk of the activities and things that you want to do, but it's really nice to see things moving in this direction. And of course, we want to use minimal measures to reach these goals. So again, we will be considering all things, all perspectives as we continue to meet with public health. And obviously the task force will not exist once we're out of the state of emergency, but then it becomes public safety and public health. And again, Mohawk Council will be working directly, collaboratively as we go through the state of recovery. And again, we're moving as quickly as possible. Maybe it's not at the rate that people would like. They want things to be 100% back to what normal was like, I'll say, in 2020 before the first closures of March 13, 2020. But I don't know if there's ever going to be back to 100% normal. And I'm cognizant, as a community, there's a lot of work that we have to do together to maybe repair some of the, I'll say, tertiary damages as a result of this pandemic, and that's with our social being and who we are as a people. And I talked about that collectiveness earlier, and the fact that we might be a little divided now as a result of this. But to me, at the end of the day, if we look at, did we achieve our goals? Did we get out of this the best way possible? And I'm not saying we are 100% out of it, but this is like the 4th wave now, where we've gone through these ebbs and flows of different measures and directives. And I don't know what the future holds, but I just, again, hope that we could see and understand that all of this was done in the best interests of the community in protecting everybody, and that all of you did your part. And so let's enjoy this time now that we're able to gather again. I'm really looking forward to being able to reconvene with my family and my friends and the people that I've missed and had to make sacrifices as we've all done. So with that, and I don't want to take too much of your time, obviously more to come in terms of updates as we move into this state of recovery. but just thought it was important to come on here and be a part of this sharing of the good news that will be starting on February 14th. So Tonya Wanage, Nyawadzi Zuwata Husadede, and we'll see you next time.